1999. Just like yesterday. I was previously a missionary to prostitute. Before you know it, the HIV/AIDS pandemic started. I still remember this one vividly. And I told my wife, I said, honey, you know what? I want us to start a ministry that reach out to people living with HIV/AIDS. This beautiful lady looked at me and she said, honey, you know what? If the Lord is leading you, I'm going to back you up. I was in my office one day and somebody came to me and said, Bayo, there was a lady she would like me to meet. I went to their house. When I met her, it was a really bad case of HIV. As our child had HIV, she had HIV, and her mother threw her out at that point. So I went in, I was able to talk to her mother. Don't worry, we take her up. And we took her up. We provide food for her. We got medicine for her. We got medicine for her baby.
Women of Hope started about 20 years ago, 2003. The women that my husband was working with, we were giving them medicine, but they didn't have enough money to buy food stuff so that they could take food with their medicine. And so he asked me if I would teach them how to sew, how to make quilts. And they have been taking care of themselves now, sustaining themselves and their families for many years. I'm looking at this picture right now from quite a few years ago of some of the first children who lived in Beezer Home. And when we first started housing children in Beezer Home, of course, we knew that we would send them out to schools.
We have a number of students which are currently on scholarship. There are others who pay the normal fee. And for us, basically, it's about raising lifelong learners. We believe that if children can be lifelong learners, they could be self-motivated and excel.
Here we offer general consultations, we conduct lab tests, we administer drugs, we have antenatal, delivery, postnatal, we offer family planning services, we take care of wounds and burns, and then we also do immunizations and basic surgeries.
I lost my husband when I was with my last child pregnancy, 2 months, when I came down to Jos. And I have children to cater for. Mashiah have been there for me and even offer my children scholarship. I was down, it was Mashiah that picked me up. I was having seriously sleep discs, in which I don't know how to even move my legs or to walk. The daddy of this school even sent for somebody to call me at home. They managed to pick me up out of pains, brought me here to Mashiah clinic, and they treat me free of charge without paying any dime. Even offer food to us, gave me money for my medical checkup.
We serve different categories of children in this department. The first of such category are the children that we take care of at the care home.
Na gode ma Mashiah abinda suka yi. Na rasa iyayena, mamana da babana su ne suka taimake ni da yara a makaranta da kuma scholarship da kuma abinci. Ina ce na gode.
We provide them with the basic health care, we provide them with nutrition, we provide them with protection, we provide them with shelter, we provide them with clothing, we provide them with education. Then we have another category of children that we support at the community. And these categories of children, we provide them with education through scholarship.
I want to appreciate Mashiah for the support given to me. They gave my 3-kid scholarship here. So I want to appreciate them, and I pray that God Almighty will continue to bless and guide them.
to address the issue of poverty, we also built the capacity of women in the areas of entrepreneurship, income generating activities, in order for them to build the economic state of their community for sustainable families. Of recent, we have been carrying out climate change education and training vulnerable communities in the areas of, not just vulnerable communities, other communities as well, in the areas of sustainable agriculture using organic farming.
You see, from that little beginning to what we are today. I mean, you can see Mashiah Foundation, the school has grown, the hospital have grown, the children have grown, and you can see what the grace of God can do.
And as for the future, well, whatever needs we see in front of us, we're passing through difficult economic times in Nigeria right now, and I'm sure the Lord will lay some more things on our hearts as we look at the needs around us. So we're just open to responding to needs as we see them.